Welcome to a video regarding our group project on a case study. The aim of this project is to solve the case study and introduce you to the infectious agent Legionella Pneumophila. We were presented with the following case. A 40-year-old male with multi-system failure secondary to bilateral pneumonia was brought to the hospital. He had already been to the doctor 3 days prior for fever, malaise, and vague respiratory symptoms. He was given amantadine, but his condition became progressively worse with shortness of breath and high fever. A laboratory examination revealed abnormal liver and renal function, and therapy with timentin and trimethoprim sulfamethoxazole was started. A bronchoscopic examination was done, which revealed mild inflammation of the airways containing thin, watery secretions. A cram stain of bronchial washings was carried out. Judging by the clinical symptoms, laboratory findings from culturing and gram staining, and response to medical treatment, the patient suffers from Legionnaire's disease, a bacterial pneumonia caused by Legionella pneumophila. Legionella pneumophila is a gram-negative rod-shaped bacteria species from the Legionella family. It is aerobic in nature and non-encapsulated and flagellated in structure with a single polar flagellum. It is pleomorphic, meaning it exists in many distinct forms or strains, equivalent of polymorphism in large animals. It is pathogenic to humans, causing severe pneumonia. Here, we can see what the bacterium looks like both under an electron microscope and in a gram stain. Due to its unique lipopolysaccharide content on the cell wall, Legionella pneumophila stains poorly with normal staining methods, and therefore an enhanced stain was required for imaging. Legionella can also be detected by culturing in buffered charcoal yeast extrude media and with a urinary antigen test. So, how do humans get infected with Legionella pneumophila? Legionella mainly resides in natural freshwater bodies, but in nature, its concentrations are not high enough to infect humans, so it mainly infects amoebae. However, man-made freshwater bodies, such as humidifying air cooling systems, showers, faucets, hot tubs, decorative fountains, hot and cold water tanks and pipes, and water heaters, can provide excellent breeding grounds for the bacteria. Once inside, the bacteria proliferate in biofilms, increasing the bacterial concentration of the reservoir. The bacteria are dispersed from the reservoir into the environment in the form of aerosols and droplets. When humans breathe them in, Legionella pneumophila enters the lungs and begins the infection. Rarely, aspiration of contaminated water can also cause infection, but regular swallowing doesn't, as the bacteria can only enter through the lungs. Untreated, the infection can even progress to death, so let's see how. Here, you can see a simplified figure of the life cycle of Legionella pneumophila. Once they reach the alveoli, the bacteria are phagocyte hosts by alveolar macrophages. However, instead of being digested as other foreign material, Legionella form structures called Legionella pneumophila containing vacuoles for protection. To avoid digestive phagosome formation, the bacteria delay endosome fusion, while simultaneously recruiting vesicles and membrane from the host cell secretory pathway. Inside of these protective vacuoles, the bacteria are free to proliferate with proteins and nutrients acquired from the host cell vesicles and without being recognized as pathogens and destroyed. During the later stages of infection, the bacteria exit the vacuole into the host cell by pore formation and membrane lysis. This causes structural and functional disruption in the host cell, leading to osmotic lysis of the host cell and release of the bacteria into the extracellular environment. From there, they can either enter a metabolically low activity stage, viable but non-culturable, or move on to infect new macrophages. Legionella pneumophila incubates in the host for 2 to 10 days before symptoms arise. First, the symptoms are mild and resemble the common cold, with low fever and coughing. As the disease progresses, the symptoms shift to pneumonic, with worsening cough, high fevers and chills, headaches, and abnormal renal and hepatic function. In late stages, the respiratory problems worsen into bloody cough and severe breathing problems requiring mechanical aid, such as a ventilator. Eventually, the patient's ability to breathe ceases completely, leading to death. There are several risk factors associated with the onset and severity of Legionnaire's disease. The most important one is old age, with 3/4 of the cases being diagnosed in people over 50 years old. Lifestyle factors play a role, such as heavy drinking and smoking. Immunosuppressed people are at an increased risk, as well as people with other underlying conditions such as diabetes and renal disease. Interestingly, men are at higher risk of developing the disease than women, with 70% of the cases diagnosed on men. Now that we know about the infectious agent, what it is and what it does, how can we treat the disease? Since the infection is bacterial, antimicrobial agents are the most common form of treatment for Legionnaire's disease. Antibiotics, including macrolides, tetracyclines, ketolides, quinolones, and erythromycin, can be administered depending on the patient's contradictions to the substances. Some of the antimicrobial drugs, shown here by category, are levofloxacin, moxifloxacin, azithromycin, clarithromycin, doxycycline, and minocycline. The most effective drugs, and the most preferable for administration should the patient not have contradictions to them, are erythromycin, rifampicin, and azithromycin. These drugs are especially effective against the bacteria due to their excellent ability to penetrate cells and access intracellular compartments, such as the vacuoles where the bacteria reside. Thank you for watching this video. We hope you enjoyed it and learned a thing or two about Legionella Pneumophila and related disease. For more detailed information, please visit our website case-study.eu.